Welcome to The Explainer. So, if you're working in health tech, you know that selling your product isn't exactly simple, right? It's more like a maze full of different customers who all want different things. Well, today, we're giving you the map. We're going to break down the key customer segments to help you navigate this really complex but super important industry. Okay, let's kick things off with a million-dollar question. Who is actually your customer? It sounds pretty basic, but in the world of healthcare, the answer is way more complicated than you might think. See, here's the thing. Selling a healthcare solution isn't like selling anything else. You're not dealing with a single buyer. You're dealing with this whole interconnected network of people, and every single one has their own unique needs and motivations. If you get this wrong, if you target the wrong person, even the most brilliant technology is going to fall flat. But if you get it right, well, that's when you can truly change lives. All right, let's start with the first major landmark on our map, the providers. These are the folks on the front lines, the doctors, nurses, clinics, and hospitals that are actually delivering care day in and day out. Now, it's so easy to just lump all providers into one big bucket, but that's a huge mistake. The reality is, what a massive city hospital needs is worlds away from what a small, one-doctor clinic in a rural town needs. We're talking completely different resources, different priorities, and totally different ways of buying technology. This table really breaks it all down. If you're selling to a big hospital, get ready for a long, formal sales process. You've got to prove your tech is secure and that it integrates with all their other systems. But then you look at a primary care clinic like a Puskesmas in Indonesia, and suddenly the top priority is ease of use and, is it practical? And then you've got the solo private doctor. For them, it's often a super quick decision, all about convenience and whether it directly helps their patients, because the doctor is the buyer. Okay, let's move on to the next critical piece of our ecosystem. We're talking about the whole reason the system exists in the first place: the people, the patients, the end users. And just like with providers, we absolutely cannot treat patients like they're all the same. A health app that a 25-year-old tech worker loves might be completely baffling and unusable for an elderly patient who arguably needs it even more. This is what we call the digital health gap. I mean, just look at the contrast here. You've got your younger urban user, they're digital natives, they'll try new tech, but they're going to be really demanding about data privacy. On the flip side, an older user might just need a super simple design and maybe even a person to help them get started. Your product, your marketing, your customer support, it has to be able to speak to both of these worlds. And of course, financial reality is a massive factor. A middle-income professional, they might happily pay a premium for something that saves them time. But for lower-income folks, it's all about cost. They're often relying on government programs. So your business model has to understand that what one person sees as value is completely different for someone else. Okay, so we've covered the people who give the care and the people who get the care. Now let's follow the money to our third major segment on the map, the payers. These are the organizations that fund this whole system. And believe me, they have a very different way of looking at things. To really get a sense of the power that a national payer can have, just look at a market like Indonesia. Their national health insurer, BPJS Kesehatan, covers more than 240 million people. Let that sink in. When one organization is footing the bill for pretty much an entire country, its decisions literally shape the whole health tech market. So here's what makes payers different. They're not focused on a single patient's experience or a single doctor's workflow. They've got this 30,000-foot view. They're thinking about the health of their entire population. Their biggest drivers are things like managing costs, making the whole system more efficient, and getting better health outcomes at a massive scale. So if you walk into a meeting with an insurer, these are the questions you've got to answer. Can your tech make our system more efficient and actually reduce costs? Can it help us better manage super expensive chronic diseases like diabetes? Will it make our members happier so they stick with us? And can it help us offer new kinds of care, like telemedicine, that are more cost-effective? And hey, payers isn't just a code word for giant insurance companies. There's another really powerful group that's paying for healthcare: employers. More and more, companies are investing directly in their employees' health to keep their own costs down and keep their people productive. So what's on their shopping list? It often looks a little different. They're really focused on prevention. They're buying things like wellness apps, mental health support, and fitness trackers. Why? Because a healthy workforce is a productive workforce. It's a straight-up investment in their own bottom line. Okay, so we've explored the three key territories: the providers, the people, and the payers. Now let's bring it all together. how do we turn this knowledge into a real, actionable strategy for getting through this maze? This quote really says it all. You just can't build your product in a bubble. A tool that a doctor loves is totally useless if patients find it confusing or if the insurance company refuses to pay for it. Real success in health tech means understanding how all these pieces fit together. It's an ecosystem. So when it comes right down to it, your customer isn't one person. It's a whole network of people. To succeed, you have to deliver real, clear value to everyone in that chain, to the doctor who uses it, to the patient who benefits from it, and to the organization that's paying the bill. You got to solve a problem for all of them. So, we've given you the map. We've laid out the landscape of the health tech world. By understanding the different needs of providers, people, and payers, you can now plot a much, much smarter path for your product. The question is, now that you have the map, where will you go first?